Now, before we proceed, yes, you are reading that title correctly. And that title being Vitamin B is an effective cure for many intestinal patients with chronic fatigue. There's a caveat. In a certain group of patients, about half, about say to be accurate, 42%, but about half, they had high levels of Faecalibacterium, Prausnitzii, or Roseburia hominis. If those bacteria were high, then vitamin B1 had a miraculous effect at reducing the markers of fatigue. So keep that in mind as we proceed. Now, there's going to be some caveats. Well, what if I increase my plant fiber, so on and so forth, which can correlate with higher levels of Faecalibacterium prausnitzii or Roseburia hominis? That's for another study. And it's a good question, but still needs to be validated. But to proceed forward, a cure for many patients with unexplained fatigue. For some patients, fatigue can be explained by lack of iron, vitamin D, or low thyroid function. These are all conditions that are easy to treat. But a large group of patients with inflammatory bowel disease remains with unexplained fatigue. To quote, "We really want to help them. And although we don't have an explanation," their words, not mine, "we now have a cure for those that have many Faecalibacterium prausnitzii in their gut," quoting the lead researcher. Quote again, "Therefore, we now recommend high-dose vitamin B1 treatment to all our patients where we don't find any obvious explanation of chronic fatigue. We know that it only works for about half, with high levels of that bacterium, but it's still a good chance in a month's treatment, the length of the study, even though it's a randomized crossover placebo-controlled study, is cheap," he adds. The clear recommendation also comes because the treatment has proven to be completely free of side